Okay, if you're studying for the NCLEX, you know some topics feel less like a chapter and more like climbing a mountain, right? Well, in this explainer, we're going to give you the gear to conquer some of the absolute toughest peaks. We're talking clinical math, therapeutic diets, and those tricky electrolyte imbalances. Let's get you prepped and feeling confident. Does this sound familiar? Yeah, this is a real post from a nursing student, Queen Hot Dog, over on Reddit. And they're talking about that nightmare of IV calculations, that feeling of just hitting a wall, of overthinking something until you're completely stuck. It's such a shared experience. And that's the most important thing to remember right now. You are so not alone in this. These topics are tough for sure, but they are not impossible. So we're going to break them down together into simple, manageable pieces. Okay, let's dive in. Here's our game plan for today. We're going to start with that big one, conquering clinical math. Then we'll get into decoding therapeutic diets and the supercritical risk of dehydration. After that, we are going to simplify electrolytes with some killer memory tricks. And finally, we'll build out your personal NCLEX command center with some top-tier resources. All right, first up, dosage calculations. Now, the key here isn't about being some kind of math genius. It's about finding a reliable system that just clicks for your brain. So in the world of nursing math, there are basically two main schools of thought. You've got the formula method, and you've got dimensional analysis. Some people absolutely swear by one, while others find it completely confusing. Look, there is no single right way. The only right way is the one that gets you the correct answers safely and consistently, every single time. So let's take a look at both. Okay, the formula method. This is for all you people out there who like structure, who like a good checklist. It breaks a really complex problem down into a series of smaller, logical calculations. First, you find the drug's concentration. Then, you use that classic nursing formula, you know it, desired over on hand, to find the dose. It's a rock-solid, step-by-step approach that really prevents you from getting lost in all the numbers. And then you've got dimensional analysis, which one professor brilliantly called the lazy mathematician's method. And I mean that in the best way. Instead of doing multiple steps, you build one long, kind of elegant equation. You just arrange all the fractions so that the unwanted units cancel each other out, leaving you with only the unit you need at the very end. For some people, this method is a complete superpower. It's fast, it's efficient, and it solves everything in one single go. All right, moving on. Just like getting the math right, understanding diets is all about patient safety. And this is so much more than just what's on the meal tray. It's about the physiology behind why a patient needs a specific diet and the hidden risks you really need to be able to spot. So here are the heavy hitters you'll definitely see on the NCLEX. For renal diets, you're thinking low protein, low sodium, and low potassium. For cardiac, think low fat and low sodium. And for gluten-free, just remember to avoid brow. That's barley, rye, oats, and wheat. Seriously, simple tricks like that are absolute gold. But a diet isn't just about the food, right? It's about the patient's ability to actually consume it. Take dysphagia, or difficulty swallowing. We often use thickened liquids to make swallowing safer and prevent aspiration. But here's the crucial point. These thickened drinks are, well, they're often unappealing, and studies show that patients on thickened liquids might only drink about 30% of their daily fluid needs. That puts them at a massive, massive risk for dehydration. So if a patient is at risk for dehydration, they're probably at risk for malnutrition too. So how can you spot this early on? Well, there's a simple tool called MUST, the Malnutrition Universal Screening Tool. It's a quick 5-step process that lets you score a patient's risk right there at the bedside. Okay, deep breath. Let's tackle the topic that makes even seasoned nurses pause, electrolytes. These tiny little minerals from huge jobs, and when they're out of balance, it can be life-threatening. But don't worry, we're going to use some really simple mnemonics to make these stick. Here are your key players. For potassium, remember it pumps the heart. Its normal range is 3.5 to 5.0. For calcium, think of the 3 Bs. It keeps your bones, blood clotting, and heartbeats strong. And for magnesium, just remember it mellows the muscles. Normal is about 1.3 to 2.1. These simple phrases connect the electrolyte directly to its main job, which makes recalling them so much easier under pressure. All right, time for a quick clinical pop quiz. You're looking at an ECG strip and you see these tall, tent-like, peaked T-waves. What electrolyte imbalance should immediately jump to your mind? If you said hyperkalemia, you are exactly right. Tall, peaked T-waves are a classic textbook sign of high potassium. This is exactly why we remember potassium pumps the heart, because when it's too high, it creates this dangerous cardiac instability that can lead to fatal arrhythmias. Let's do a quick side-by-side for sodium. With hyponatremia, that's low sodium, I want you to think low and slow. The brain is the most affected here, leading to confusion, seizures, even coma. Now with hypernatremia, high sodium, think big and bloated. That means edema, flushed skin, and a swollen, dry tongue. The contrast between those two phrases makes each one so much easier to remember. Whew, we have covered a lot of ground. We've broken down math, we've decoded diets, and we've simplified electrolytes. Now let's pull it all together and equip you with the tools you need to keep practicing and to build that unshakable confidence. You do not have to study in a vacuum. These are some of the top resources recommended by other nursing students who have been right where you are. DosageHelp.com and RegisteredNurseRN.com have tons of practice questions. For video explainers, check out RN Kid and IntelliLearn on YouTube. And if you really want to master dimensional analysis, a lot of students swear by a chemistry teacher on YouTube named Tyler DeWitt. Okay, so you've seen the methods, you've got the memory tricks, and you have the resources. You have everything you need to turn that panic into real confidence. So the only question left is, which one of these tools are you going to add to your study arsenal? Today, you've got this.